Bernie Sanders, independent from Vermont, but a frequent guest on this network to talk about health care. He's joining us on the phone from his Capitol Hill office. Senator, thanks for being with us.
Good to be with you.
There is no public option in this plan. Your reaction?
Well, we're going to do our best to put a public option in the plan. I think public option is important for two reasons. Throughout the country, millions of Americans do not have faith in private insurance companies. I think they perceive correctly that the function of a private insurance company is to make as much money as possible rather than to provide affordable quality health care. And they want that public option, a Medicare-type public option. I think they should have it. Second of all, with health care costs soaring and projected to double in 8 years, it is absolutely imperative that private insurance companies have competition from a strong nonprofit entity, and that is a public option. So I think for those two reasons, it's absolutely imperative that we have a public option. Some of us believe that if the Republicans are not willing to help us address the health care crisis that this country faces, if they continue simply to say no, then we will go forward with reconciliation, and I would hope that within a reconciliation package would be a public option.
But how would you do that legislatively? How would you insert that into the bill?
Well, let me tell you something. Years ago, when Newt Gingrich was the Speaker of the House, you'll recall his contract with America, which is a fairly, it's a bill that I strongly oppose, but it's a very comprehensive approach dealing with a number of issues. He passed that in the Senate through reconciliation. George Bush got some major tax breaks for the wealthy through reconciliation. They cut Medicaid through reconciliation. So reconciliation is not a new idea. It's an idea that has been used by Republicans for many instances. And I think it is a legitimate tool to use, given the crisis that we face right now. Doing nothing, to my mind, is not an option if we're talking about doubling the doubling of health care premiums in 8 years. We are all familiar with what happened in California, 39% proposed rate increase from Anthem Blue Cross. That is not sustainable. Something has got to happen. And if the Republicans do not want to work with us, that's fine. Then we go forward with reconciliation.
Looking at what the President put forth, though, today, is there anything in the bill that you think you like? Yeah,
I think it's a better bill than the bill that passed the Senate. I think it makes premiums more affordable. I think that's important. I think in the Senate, I work very hard on primary health care. I think that is an area that doesn't get enough discussion. We have tens of millions of people, some with insurance, some without, who can't access a doctor, end up in the emergency rooms, or get really sick and end up in hospital at great expense to the system. The President has proposed $12.5 billion for community health centers and the National Health Service Corps, which means that we're going to start training primary health care doctors, dentists, practitioners. I think that's very important. In the President's approach, as I understand it, he intends to close the donut hole over a 10-year period. That is extremely important. Many seniors just having a hard time paying 100% of the cost when it's in the donut hole. Also importantly, I strongly oppose this tax on health care benefits. I think it's a bad idea. While the President still has that tax in the bill, it has been pushed back by a number of years, and and when you hit the level to be taxed has gone up fairly significantly. So I think that that's an improvement as well.
And right now, the taxes for an individual, if it's over $200,000, and for a family over $250,000, but some have said that other tax brackets might be impacted in order to pay for this.
You're talking about what's in the House.
Mm-hmm.
Well, I was talking about in the Senate.
Right, no, I understand that.
Yeah,
I mean, that's one of the issues.
Look, the simple truth is the middle class in America is collapsing. The gap between the rich, the very rich, and everybody else in this country is much wider than any place else in the world. And the people on top have enjoyed huge tax benefits from Bush. So I think it is fair to ask the very wealthiest people in this country to start paying their fair share of taxes so that we can move forward on health care reform.
But where do you draw the line? How do you define wealth?
Well, when the top 1% earn more income than the bottom 50%, when the top 1% own more wealth than the bottom 90%, when the middle class is in the midst of a major descent and collapse, when you have the guys on Wall Street bringing in tens and tens of millions of dollars in bonuses after having destroyed our economy, I think we can find the money from upper income people.
Senator Bernie Sanders, thanks very much for joining us from your office here in Washington.
Thank you very much. Bye-bye.
We want to hear from you here on C-SPAN, 202-737.